Have you guys heard of Bremelanotide or PT-141? Well, I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm going to explain to you all about how Bremelanotide can be used to increase libido and potentially even help with erections. Bremelanotide is a melanocyte stimulating hormone analog, meaning that it works just like MSH. And it's been studied for both men and women and is FDA approved for women with hypoactive sexual desire disorder, similar to that little pink pill I talked about in my last video. However, this is used as needed 1 hour to 45 minutes before sex, so an hour before you want to want. And interestingly, it works on the brain. So let's take it back. The melanocortin system is a group of substances. All of these things together control several different things, like how much we eat, how we feel pain, the color of our skin, and even our sexual activity. So very simply, melanocortins are excitatory signals that reach certain areas of our brain, like the cortex and thalamus, which then cause increased sexual receptiveness, meaning they feel more desire for sex when they are stimulated. And so scientists initially studied this melanocyte stimulating hormone in animals, and what they found was that it led to increased sexual receptiveness, and it led to two interesting findings. One is that there was an increase of nitric oxide in the genitals, and if you're new here, I'll tell you that nitric oxide is the ignition for erections and sexual activity. It also led to dilation or opening up of blood vessels so that more blood flow was able to get to the genitals. And this then led to the development of Bremelanotide, also known as PT-141. And so as I mentioned, this has been approved for premenopausal women. And when they looked at women taking this medication under functional MRI studies, which means they could watch the brain change or light up different areas when the patient took Bremelanotide, they found that certain areas of the brain that were usually decreased in activation in patients who had hypoactive sexual desire disorder were activated, meaning that they were more easily aroused when approached with erotic stimuli. It also decreased activation in certain areas, allowing there to be less self-consciousness, and they increased some areas of connectivity in the brain, which may lead to, again, greater sexual arousal. So what they found is that in these women, they had increased sexual desire for up to 24 hours after taking the medication. They noticed that the increase in desire was seen in about 2.5 times more women than those getting a placebo injection or injection without any active ingredient in it. And interestingly, they also found that women had a little bit of decreased hunger when taking this medication. Now, this was in a small study looking at the brain, but in larger studies in multiple clinical trials, they saw similar effects, being 2.6 times increase in sexual desire in women taking Bremelanotide. Now, it's recommended that you take it only once within 24 hours and no more than 8 times a month. If you're gonna take it, you need to take it with birth control because the effects on a growing fetus are yet unknown. It is contraindicated in anyone who has uncontrolled high blood pressure or heart disease. And the most common side effect is nausea, which occurs in up to 40% of women who take it, but this can be treated by taking antiemetics or medication to decrease nausea at the time of administration. Also, that nausea tends to decrease after the first time you take it. Other common side effects were flushing in about 20%, headaches in about 11%, vomiting in 5%, and focal hyperpigmentation in less than 1% of patients. And that meant that they were a little bit more tanned or darker in areas like the face, the gums, and the axilla. So this is a great option for women, but what about men? Well, Bremelanotide has been studied in a subset of men for the purposes of low libido and erectile dysfunction. The number of patients that have been looked at have ranged anywhere from 19 patients to up to 342 patients. And in these small studies, these men took Bremelanotide either as a nasal spray or as an injection. And what they found was that Bremelanotide did increase low desire. It also increased the rigidity of the erection, the duration of the erection, and overall satisfaction with sexual intercourse. The side effects most commonly were nausea and flushing. In the largest study, 342 married men were recruited who had taken sildenafil but didn't respond. And they were given either 10 milligrams of Bremelanotide as a nasal spray, or they were given a placebo. And they were told to use it 45 minutes to 2 hours before intercourse, and they had to try it for at least 16 uses over the course of the study period. They described a positive clinical response as ability to maintain an erection and satisfaction with intercourse. And they saw a positive response in 33% of men who took the medication versus 8% of men who took the placebo. And so this sounds great. Do we have a new option for erectile dysfunction or even low desire for men? Not yet. So this is still in clinical studies is for men. It has not gone through the rigorous trials it needs to go through to become FDA approved as a medication for low desire or erectile dysfunction for men. However, it is given off-label. From what I understand anecdotally is taking this medication gives you a very strong desire for intercourse, which can be very uncomfortable if intercourse is not on the table. Also, it is associated with some nausea, and usually after using the medication, you can feel as if you've got a cold or some significant fatigue after it wears off. Generally speaking, if you've got really bad high blood pressure or really bad heart disease, I don't recommend trying this. And if you really want to try this, I suggest you see a urologist or other healthcare provider who is expert in sexual medicine so that you can be overseen and make sure that you're doing well on this medication, you're not having any adverse effects, and that if you do have a problem, that someone else there to help take care of you. All right, I hope this answers some of your questions. As always, you're going to take care of yourself because you're worth it.